Good evening, friends. Let's start so that others can join us as we go on. This is last Saturday of the month, and I wanted the cycle to go on. So in spite of hectic interventional nephrology meetings this week, I thought I should continue. And topic today is on AV fistula. And you all know that AV fistula is the most gratifying of all the interventions we do, but yet it is the least practiced because of various reasons, practicality. And also we have in our mindset that, this is more of a surgery. This involves cutting and suturing, and it is predominantly in surgeon's domain. And also time and again, we come across failed AVFs done by others. And, these things are quite intimidating, and nobody wants to take it up, because I've been meeting juniors with a lot of interventional ideas, but AVF is the one which has been having the least takers. But I think it is slowly changing. So we wanted to demonstrate today that it is quite feasible and possible, and it needs slightly more perseverance and more exposure and training than other procedures like tunnel catheter and PD catheter. And so we have Shailendra Shasta from Nepal, who will be, I particularly chose him because he got into this by necessity, and he took pains to come to India, learn from centers, and I met him when I went there as ISN ambassador. So before that, let me introduce our guests and the panelists and the speakers. Then we'll go on. Yeah, so I welcome Professor Rana, who is too well known to all the audience here, and he has reached a stage where these two big awards would tell much more than what I am going to tell anything about him. He is a Padma Shri Award recipient in 2009, and the BC Roy National Award, which is even more prestigious for the teaching ability of a person. And more important, presently he is the chairman of Sir Gangaram Hospital. And he has the credit of having started the nephrology department there from the scratches. And he has been sticking on to the same institution from 1981. And he has grown to the stage of becoming the chairman of the hospital. And I should add that he was born and educated in a remote village in Himachal Pradesh. And from there to grow to this stature, I think it is a great credit to him, and the amount of struggles he should have undergone. And he has had most of the posts here. He was the president and secretary of Indian Society of Nephrology, and he founded the Indian Society of Hemodialysis. And I'm glad he is around. And another specific reason why he was invited is he has the credit of, he is believed to be the first nephrologist who undertook AV fistula construction in a big way. I think that was the specific reason he is here. And it is very apt that he, before we start, he would give us his impressions after I finish the introduction of the speakers. Next, the other panelists, we have Joseph Satyanathan from UK, and he is a vascular and endovascular surgeon. So he's the only odd man out here in this group. I particularly invited him because AV fistula particularly has some vagaries, unlike other interventions. He qualified in Madras Medical College, and I was familiar with him. He was 1 year junior to me, and he was the Johnson gold medalist, gold medal winner, which is the very prestigious, best outgoing student of the college. And going from Tirunelveli, from my place, to MMC and becoming the Johnson gold medalist, I used to get impressed by him. Yet he was very quiet and very little seen, and I hardly had to meet him later. But I came across him again when he had to talk to me for some relatives here. Then I thought, why not bring him here? He had his vascular training in many reputed centers in UK, and has advanced endovascular training in Ireland, France, Italy, and Germany. And calling a vascular surgeon is particularly apt here because vascular surgeons are basically not cath lab fellows. They got into it later, sort of grabbed it from interventional radiologists, like how we are trying to usurp some of our areas of interventions from other specialties. So, he would tell us the advantages and disadvantages and how they went about, drawing these interventions into their fold. And next, we have Vail Aravind. Vail Aravind is becoming a star interventional nephrologist these days. And I think he's one of the few full-time interventional nephrologists. Of course, he does a lot of clinical work and transplant. Like Adil, the other day we saw. He started his career from Tanjore Medical College. Then he went out to Gujarat, where he had his MD and he had his DM in Ahmedabad and the prestigious Institute of Transplant Sciences, where he took all this passion for interventional nephrology. And what I like in him is, he is very fond of teaching and innovating, and he has been a big colleague to me in all this my endeavors in interventional nephrology. Welcome, Vail Aravind, and he does all sorts of AV fistulas, including transposition and AV grafts. And Sachin Soni is from Aurangabad. He is a consultant nephrologist in Medicover Hospital. And I have seen him in many ISNs and interventional nephrology meetings. But I particularly thought about him for this meeting because he is the one who taught Shailendra Shasta to do AV fistula. And I thought he would be very happy to see his student presenting to another larger audience today. And after finishing his nephrology here, he had his fellowship in University of California, San Diego Medical Center, and he had an observership in Nadiad. All this made his skills as interventional nephrologist sharp, and now he is into many aspects of interventional nephrology. Welcome, Sachin. Then Shailendra Shasta, about him I already mentioned. He is an young, energetic nephrologist practicing in Biratnagar in Nepal, attached to Noble Medical College. I came across him when I went to his place as an educational ambassador, and I was trying to teach, some aspects of AV fistula, PD, and PD catheter was done there for the first time when I went there. And before I could reach back in Tirunelveli, he had already done 2 cases independently there. That showed his speed and energy, and also, going back to a smaller place and trying to do interventions, risky interventions like this, he would be having a lot of things to share to us. So I chose him to be the speaker today, and also to encourage others to show that it is quite possible for somebody to do like that. And this is Dr. Venkatramanan. From KVR Kidney and Diabetic Center in Vellore. After finishing his MBBS in Stanley Medical College and MD in Tanjore Medical College, he had his DM in Ram Manohar Lohia Hospital, and he was the best meritorious performance in DM nephrology, and he got his skills toned up there. And he does AV fistulas, PD catheter insertion, and many of the interventional procedures. But peculiarly, he had trouble starting his practicing these skills in his place in Vellore. And I thought he would be the right person to tell us the audience he went, the resistance from hospitals and other specialists for him to do his work. So he will give us a short experience of this in that point of view. And last, Dr. Atul Thomas from CMC Vellore. Dr. Santosh Varghese introduced me to him. He said all the interventional work is being supervised by Atul now, so you contact Atul. And he is going to tell us, PD, we had the session last time, and particularly the initial peritoneal puncturing with the needle. So that is one aspect many newcomers, freshers would be scared of. So he would give us a short demo of how he does it using a virus needle. I think from this, we can go on to the session. I request Professor Rana to sort of give his opening remarks in this forum where AVF will be discussed, and he being a pioneer, and we are eager to listen to you, Dr. Rana, and after that, we will go on to the speakers.
Thank you, Professor Suramaniam, for inviting me for today this function and to be with the young people today. I'm just completed 72, so I feel very privileged to be with young people, and I'm very glad that young people have started following interventional nephrology, and today is a subject which is very dear to my heart because I took out of necessity, And just to tell you that I did my MBS from Medical College Simla, and at that time in the initial years, there were no postgraduates there. So we were very lucky that during internship, we did so many surgeries, including appendicectomy and but all procedures that kidney biopsy, liver biopsies, and daily it was practiced to cut down. Then I joined PGH Chandigarh as first year agent. Then I was posted for first 2 months in emergency, where patient of acute renal failure, they used to come and surgically start you to make shunts. So one day I just asked him that, can I assist you? So I thought it's just making cut down what is such a simple thing. So then my next posting was in nephrology. I started making AV shunts there. So AV shunts I learned, I started practicing at PGH Chandigarh. Then I came to All India Institute of Medical Sciences, and I started making difficult AV shunts and all those things. One day I was, Dr. Professor Dhawan used to make AV fistula occasionally on BVIPs. But AV fistula was not made for common people at APA Institute. It was predominantly a transplanted oriented unit, and BVIP were also accepted for dialysis only for giving 1 or 2 dialysis and wait for their death. The occasional patient, there used to be AV fistulae. I assisted first AV fistulae with Professor I.K. Dhawan, who we lost recently. He was a pioneer transplant surgeon in the country. And he was making AV fistulae on the leg. And so he just asked me, assistant, he was a patient was one very important MP. And I learned and assisted him. And probably that was the last day when Professor Dhawan made any fistula later on, because I learned it and I thought this is such a simple thing, I can do it, Then I was amused that why did he create that fistula at leg, which was of no use of patient, But it was just a fistula, that's all, but not of any use of nephrologist. So that is why how during my DM training or MNS at the time called, with the help of senior dialysis technician, gathering fuel stream for eye department, fuel for general surgery, and there were no gloves, no loops available, no vascular clamps available. By all innovative methods, I started converting all AV shunts into AV fistulae and found so rewarding for the patient. Thus, I catered about nearly 40 AV fistulae at AIMS. Then 1981, I joined Gangaram Hospital. And when Dr. Suran just now told how the nephrologists can face resistance from surgeons, it was the people, those who were chairman at that time, he was surgeon, and the secretary of the board of management was surgeon. And I just told them that I will make my AV fistulae. And they told that you have to get, there were 3 thoracic surgeons, vascular and thoracic surgeons, that each senior consultant of thoracic surgery and vascular surgery, they will supervise me doing AV fistula in their presence. And I accepted that challenge. And at the end of each remarks that he can make better than us. And that is how I started making. And probably I made thousands with innovative method, transposition, and various methods. People used to come, go to US, UK, and all those things. They used to come, make their fistulae. Later in 1987, Dr. Balla joined me. Then I made him learn, and subsequently other people joined me. And today, all DNV students, and within 2-3 months, they start making AV fistula at our center, and they all learn it. And many other centers also, they've started learning. To my west now, for next 5 years, nobody in this country was making, and nobody was making in USA, but I found one nephrologist in Cleveland Clinic, where I went on nephrology international scholarship in 1986. One Japanese doctor there, he used to make fistula himself. So I found one that at least like me, he's also making, And I still remember, I'm just saying this, in somewhere in 19, I don't remember the year, ASN was being, conducted at Toronto. And one friend like Subramaniam, one of the Indian doctor, he knew that I am making fistula, and Dr. Pravir Chaudhary. And he told that, why can't you address some American people here that we also start making it, and we create an interventional nephrology. And I addressed that gathering. They hosted one dinner also. We were 30-40 people. Mostly they were American and some of them Indian regions. And later on, you've seen that there was a birth of Interventional Nephrology Society, and also in the country also. And Avatar, which is being propagated by my first student, Dr. Sneep Jasuja. So I really feel very proud that today Dr. Subramaniam has organized this thing, and a young doctor from Nepal, which is second home to me, he is going to demonstrate AV fistulae, and various other experts are there. With these few words, I can talk about my experience with fistulae and what sort of difficulty I had and how I used to make. But that is story. But I'm really very glad that today young nephrologists, they are in various branches of interventional nephrology. And let me tell you about AV fistulae. AV fistulae, the functionality is absolutely well understood by the nephrologists. For transplant surgeon, vascular surgeon is also here. For them, it's just a very small procedure. They don't, most of the time they just continue to make you wait. And that is why this is, you can say, necessity for nephrologists to make AV fistulae. With these few words, thank you very much, Dr. Subramaniam, for inviting me today. Thank you very much.
Thank you. Indra, you share your thing and.
Should I start, sir?
Yes, yes.